So a very good morning to everybody. Today I am taking a topic which is the first topic of bacteriology, systemic bacteriology, that is Staphylococcus. Staphylococcus aureus is one of the species among the various Staphylococci. So Staphylococcus is a genus which has various species, among which Staphylococcus aureus is very pathogenic. It produces toxins, it invades the cells, and it is different from other Staphylococcus by its coagulase test. So Staphylococcus aureus is very important among all the Staphylococci. Now in general, I want to tell you about the Staphylococci. Okay. Now Staphylo, the word means grape-like clusters. Cocci because they are spherical in shape. Okay. So, as they are spherical in shape, the name came and they are arranged in groups. So, the name came Staphylococcus. Now, among these, the most pathogenic strain, that is the Staphylococcus aureus, it produces golden yellow colonies on milk agar, it produces yellow colored colonies on nutrient agar, it produces yellow colored colonies on even blood agar, but slightly visible. Because it produces the golden yellow colored colony, that's why the word came as aureus. Now, what are the infection caused by Staphylococcus aureus? So, it causes a variety of infection. Mainly, we divide it into invasion and by its toxins. So, toxin mediated injury is different, and injury caused by the invasion is different. So, what are the invasions produced by the Staphylococcus aureus? So, among the skin, when it causes skin infection, it can cause folliculitis, furuncle, carbuncle, impetigo. Then it can infect the breast. It can infect the breast, causing mastitis, breast abscess. Then it can cause surgical site wound infection. So after the surgery, when you suture the wounds, this is one of the most common cause of post surgery wound infection at the surgical site. Then it can cause subcutaneous infection, which is called as cellulitis, and it can cause hidradenitis, which is a respiratory infection. Then botryomycosis, which resembles mycetoma. Okay, it resembles mycetoma. Only sinuses are not formed in botryomycosis. Now coming to the musculoskeletal system. In the musculoskeletal system, it is a major cause of septic arthritis after usually after accidents or due to some invasive procedures in surgery. This can cause osteomyelitis. Then it can cause formation of abscess in the muscles, which is called as pyomyositis. It can cause psoas abscess, epidural abscess. In the respiratory tract, starting from the top to bottom, it can cause sinusitis, it can cause pharyngitis, laryngitis, tonsillitis. Then going deep into the respiratory tract, lower part, it can cause pneumonia, empyema, lung abscess, and it is one of the most important cause of VAP, that is ventilator associated pneumonia. It is a nosocomial infection. So people who are on ventilators might go for pneumonia, which is called as which is spread due to the ventilators, that is called as ventilator associated. It is a nosocomial infection. Okay. Now, spread of the bacteria into the blood from a pyogenic site, from any infective site into the blood is called as bacteremia, and it produces the toxins which spreads to various organs, leading to sepsis and septic shock. Okay, so it can go anywhere. Next, through the blood route, it most oftenly infects the endocardium, causing endocarditis, native wall endocarditis. So it is the one of the cause of acute and subacute endocarditis. Okay, it can also infect prosthetic valves which have been planted into the cardium to certain patients. Okay, so it infects the prosthesis and cause prosthetic valve endocarditis. Okay. So this endocarditis is most common in intravenous drug abusers. So who are taking intravenous drugs and they share the same syringe. So through that, and Staphylococcus is a commensal of our skin, our hairs, maybe in the beard, in the mushard, in my scalp hairs, armpit. So it is present over the nails also. So the commensal, so it enters it is when the drug abusers use the syringe to inject the drugs intravenously without cleaning or without producing asepsis of the site where they are injecting. So actually asepsis of the site is very important. So that's why without using any antiseptics like alcohol or spirit and iodine, they directly inject into the intravenous route, spreading the commensal Staphylococcus aureus from the skin into the blood system. Now, it is one of the important cause of both ascending and descending urinary tract infection. So, ascending urinary tract infection starts from the urethra and is ascends upwards. So, it can cause urethritis, it can cause cystitis, but descending is through the blood route, enters into the kidney and from there into the ureter where it causes infection. Okay, so ascending and descending. It is an important cause of both ascending urinary tract infection and descending urinary tract infection. Others, it can cause fulminant purpura and necrotizing fasciitis. So the fascia is totally necrosed. This is about the invasion. Now, the disease caused due to the toxins of the Staphylococcus aureus. Coming to the next topic, the disease caused by Staphylococcus aureus due to its toxins. So Staphylococcus aureus produces various types of toxins, and the toxic mediated injury is called as intoxication. So Staphylococcus, you remember one thing, that it produces infection by invasion and intoxication. So invasion part is over, now intoxication part is starting. Okay. Now Staphylococcus aureus produces toxic shock syndrome toxin, also called as TSST. It produces another toxin called as enterotoxin, which is a cause of food poisoning. It produces staphylococcal scalded skin syndrome, SSSS. Okay, these are the most important toxins. Now, coming to the enterotoxin. So, enterotoxin, as I told you, it causes food poisoning. But here, the most important thing what you should know is this food poisoning symptoms starts within 4 to 6 hours of taking contaminated food, and disappears within 24 to 48 hours without any treatment. So the intoxication is self-limiting. Okay. Now, how does it cause? So you take, whenever you take food, mainly the food is a non-vegetarian food. It may be a meat, it may be a milk, it may be a meat, egg, and it also spreads rarely through milk and milk products, very rarely, okay, mainly through the meat. So what happens, you think that I am having the bacteria in my nails, so it's a commensal bacteria, so I may be harboring the bacteria Staphylococcus in my nails. While cooking, I inoculate the Staphylococcus aureus into the meat. Now this Staphylococcus aureus requires meat for its multiplication, so it gets a good food, good nourishment, so it starts multiplying While multiplying, it starts producing enterotoxin. Now, this enterotoxin is present in the meat. So, when I eat the meat, it is not the staphylococcus which causes the signs and symptoms. When I eat the meat, the toxins which were present in the meat, the preformed toxins, they get absorbed. They get absorbed into the intestine, and from there they travel to the central nervous system and cause vomiting and diarrhea. Remember, it is not a localized reaction. So it is not localized. The toxin, as you think that if there is diarrhea and vomiting, it is a localized in the uh, small intestine or large intestine or in the stomach. No, it is not localized. It is centralized. So the toxin is absorbed, goes to the central nervous system and produces its action from the central nervous system, causing vomiting and diarrhea, which is self-limiting. Only symptomatic treatment is required. Okay. So most important serotypes are serotypes from A to E, then G to I, then from R to T and V. These are the most common serotypes which are responsible to produce the enterotoxin. Okay. So these are all the things, all the items from which, in which the staphylococcus produces the toxin. Okay. Death rarely occurs due to hypotension, due to dehydration leading to hypertension. Okay. Now next is Staphylococcus scalded skin syndrome. Okay, it produces a toxin called as exfoliative toxin, causing exfoliation of the skin, or also called as epidermolytic toxin. Okay. Now this is an infection where there are blebs over the skin. It represents as blebs over the skin, as if the skin was burnt. After skin is burnt, how it produces a blebs filled with a cavity, containing a cavity filled with a fluid. So it appears as a bleb after infection. It looks like a burnt injury. That's why it is called as scalded skin syndrome. As if it is burnt, it is called as Staphylococcus scalded skin syndrome. And it mainly occurs in infants. Whose immunity is very less, mainly occurs in infants and more commonly in the neonates. Neonates, it may lead to death of the neonate if not treated immediately. Okay, it is very rarely seen in the adults. Staphylococcus scarlet skin syndrome is very rarely seen in the adults. Okay. The next is the toxic shock syndrome. Toxic. Okay. This is a super antigen. As I have told you about the super antigen in my last class, so now I will not repeat it. So it is a super antigen which produces or which invokes the T cells to produce large number of cytokines, which is responsible for the shock. So cytokines in small amount is helpful to our body, but in large amount it produces deleterious effects on our body, leading to shock and death of the patient. Okay. This was most commonly seen in the European women in the past. In the 17th and 18th centuries, in the European women, they used the tampons made up of cotton cloth. Okay, so to absorb the blood from the menstrual fluid. As now we are using sanitary pads, at that time there were no sanitary pads, so they used to use tampons. Now, Staphylococcus is one of the commensal of vaginal tract, or sometimes the tampons may be contaminated with the Staphylococcus aureus, and blood is a very nice medium for it to grow. So when they use tampons, the Staphylococcus will multiply in the blood present in the tampon, okay, and starts producing the toxin. Okay, this toxin is absorbed through the vaginal route, goes into the systemic route and produces shock and death of the patient. It leads to shock, and so many women died due to usage of tampons. Okay. Next, it can produce from other sites like osteomyelitis, post-surgical wound infection, and abscesses. Okay, so it is a super antigen. So clinical features are fever, hypotension, mucosal hyperemia, vomiting, diarrhea,